although epilepsy is one of the world's oldest recognized conditions, the public typically doesn't know how to react to someone who has seizures. Now, here with the facts on epilepsy is Dr. Marie Eugene. You're a neurologist at UConn Health Center. Dr. Eugene, thanks for joining me.
Thanks for having me.
So let's start off by talking about epilepsy and how it can start. It can start at any age, and it may develop even though you don't have any risk factors. It's true?
Correct. So epilepsy tends to have a higher incidence in children, sometimes adolescents, as well as patients over age 65. Oftentimes, when you are seen by your provider or neurologist, we do an evaluation, and sometimes we don't find anything. Probably the biggest piece of information that we have is history and what the patient's behavior is during their seizure. So oftentimes I tell patients when they come to the office to come in with someone who has seen their seizures so that we can get a good description of them.
Doctor, what can trigger a seizure?
So some things can lower your threshold for seizure, and those one of the big ones tends to be sleep deprivation. In fact, if you don't get enough sleep and you have a predisposition towards seizure, that can be associated with seizure. Sometimes alcohol can also be associated with seizure.
And there's no known cure for epilepsy, but talk about medication. Is that effective, and to what extent?
Correct. We do not have a cure for epilepsy yet. There's research hoping to achieve that. But the mainstay of treatment with epilepsy is with anti-epileptic drugs or anticonvulsant medications. Nearly about 70% of patients do quite well with treatment within medication. If you become medically refractory, you can consider other options such as surgery, or there's a stimulator called a vagal nerve stimulator that can be implanted under the collarbone, and that sends impulses to a nerve in the neck, and so that could be another modality of treatment.
There are generalized, that's right, generalized seizures, that's what they're referred to, but then there's also partial seizures as well. Talk about the difference between the two.
So you can have a seizure coming from a part of the brain, and so we call those partial, versus a seizure that involves the entire brain at the onset, and those are generalized seizures. With a partial seizure, sometimes may present in a very bland manner. Sometimes they go unwitnessed or unnoticed by family for an extensive amount of time. So those can consist of bland staring, lip smacking, funny picking-like movements. And so the partial seizures may at times have that kind of subtle presentation compared to the generalized seizures, which may present typically with a convulsion, and that tends to be more readily recognizable.
And when you witness someone having a seizure, what's the best thing to do? How should you react and perhaps maybe help them out? Do you let them be? What would you do?
Right. So you want to try to put the patient in a position that would be safe. So you can turn them over to their side. You can remove sharp objects if they're near a sharp table or sharp objects. You want to remove those objects from them. You want to refrain from putting objects in the mouth. You would turn the patient over. That helps to get air past the airways as the seizure is ongoing. And a good thing to do is also time the seizure. And oftentimes it can be a pretty dramatic event for the person witnessing the event. But if you can sort of assess the patient's behavior during the seizure, that is often helpful information once the patient goes to the emergency room or is seen by their doctor.
Now, you're an expert when it comes to epilepsy. You've studied this thoroughly. Talk about maybe something that people don't seem to understand, perhaps maybe a misconception. What do you want to let our viewers know?
I think probably what I alluded to before in terms of the subtle presentations of some of the seizures, that it's not necessarily always a full-blown convulsion like the ones that we're used to seeing, but at times a very subtle presentation, as I said, staring or lip smacking or picking-like movements. There may be alteration of consciousness where the patient's not able to readily interact and answer questions, and those are key clues. And sort of being able to assess these events from the beginning at their onset is really big and important information for your neurologist or your provider when you come to the office.
Obviously, if you have any one of those conditions you mentioned, you would definitely want to talk to your doctor right away.
Absolutely.
Okay, thanks for coming in. We appreciate it.
Thanks for having me.